We're in the back now of our Mercedes ambulances. All of our frontline ambulances here on the Isle of Man are Mercedes ambulances. So as we'd expect, in the back there is the stretcher. These are all, majority of them now are now automated, so they will go up and down electronically. And then this is basically a mobile emergency department. It has similar equipment, if not sometimes the same equipment that you would find within any emergency department across England and here at Nobles. So I'll just point out some of our equipment. Obviously we have lots of response bags that carry our equipment. The small red one up, as you see there, is our sort of our primary bag that we take into all of our jobs that we go to. And then as we're working around the back here, we've got different ports for our medical gases. So on our vehicles we carry oxygen, as you would expect. So that's just a valve that we can give oxygen at different concentrations to the patient. And then this one is Entonox, which effectively known as laughing gas, is the pain relieving gas that we give, most notably ladies that are delivering babies use Entonox. This device in the middle between the two is our suction unit, where if you're are not conscious or we need to clear your airway, we will suction the contents from that with that device there. As we move over, this is called our core pulse machine. It's a 12 lead ECG machine, so we can look at your heart. It's also our defibrillator, and it will also do our patient monitoring, so we can take pulse rate, oxygen levels, blood pressures, a capnography to check your carbon dioxide levels, and we use it to, as I said, if you're having chest pain, undertake a 12 lead ECG to have a look at what the heart is doing. And as we go through, last item that I've got here on the stretcher is our Lucas 3. This is an external CPR device, exclusively on all of our vehicles here on the Isle of Man. And one of the clinical trials initially back many years ago, the Isle of Man was one of the first organisations to bring these into fruition. So if patients are sadly not breathing and their heart's not beating, majority of our clinicians will put this device on to the patient's chest to do CPR. So it frees up some hands for the clinicians to do other bits and pieces, secure an airway, pop a needle in to give medication through, but also it has guaranteed sort of guaranteed sort of compression depth and rate consistency, where if it's humans are doing it, we'll start to tire after a prolonged period, where that will continue to give good quality CPR until we stop it. We have a superb team of make ready team who after every shift will go through the vehicle front to back, restock it, clean it all down, so all our vehicles are immaculate inside.